From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
First of all, you need to knock. That's a very important thing. So before you go into the room, just knock. And once you go in, shake hand. Give a shake hand, a warm shake hand. So it's body language. Your good body language prepares the patient mentally for the patient encounter. So give a shake hand and then give a nice smile. That's very, very important. You should not behave that you are unhappy, and you should not give a face that you don't want to be there. You should give a smile and give warm shake hand to the patient. That's a very important skill. So when you go in, give a nice handshake, and that prepares the patient. That's a good body language. When you give a nice smile, and it warms their hearts, and you are telling them that you're happy to be there. So start there, folks. Those are the basic skills for any patient encounter. Then you talk to them. I mean, where I came from, you don't look at people's eyes, you don't look into their eyes. But in the United States, it's very important that you look into patients' eyes while talking to them. And at the same level, that also facilitates good communication. Now, never take your cell phone into the examination room. Keep it outside in that locker, and keep all your belongings in the locker, and forget about the world when you go in. And it's very, very rude to use cell phone. And I'm telling you because I have seen people who use cell phones during the patient encounter, like while taking history, they stop and talk on their cell phone. While doing physical exam, they talk and use their cell phones. I mean, that only irritates patients. As you can see here, the patient is quite irritated by the very encounter as this is going. So it's very important that you keep that skills, that you make patient feel that he is the center. And the other thing I want to tell you is never show your anxiety to the patient. Never show your anxiety. Never show your stress. And keep it in your mind. I mean, that's why I'm telling you, before you even go to the encounter, you need to make sure that you're not anxious or stressful. I mean, sometimes by pulling your coat, you show your body language. Sometimes by pulling your stethoscope. Sometimes like pulling the stethoscope around your neck. So avoid those things. Just look at the patient. That's very important skill you need to understand. So your body language should not show any anxiety. You should show that you are so relaxed, you are so happy and joyful, and you are already all right to set go. So that the basic skills that you need to have before you even start your history of present illness. So start from there. And also do not eat bubble gum. That's very important. Some people I have seen eating bubble gum in the patient encounter. Sometimes, as you can see here, they talk with a bubble gum in their mouth, and patients find it very awkward and disrespectful. And many times, I mean, I am a foreign doctor with an accent, so if I use bubble gum, I mean, it makes things worse, right? So it's very important that you have a clear mouth that is ready for good communication. So do not go there with a bubble gum in your mouth All right, that's something I want to share with you. And also hygiene. Wash your hands. And when the patient sees that you are washing hands, he feels that he's in a very clean environment. He feels that this is a place where the people follow some hygiene. They are very clean. That's how they feel. And never underestimate that. The next thing is drape. Use a drape, and a drape always keeps a patient comfortable. It gives them some privacy. It shows professionalism, because you are not just doing things like talking and examining, and you are doing it professionally. So it shows professionalism when you use a drape, and it also gives them privacy. And the other thing is, most of the times they give you vital signs, but if they don't, if they ask you, like for example, pre-employment checkup, like a physical examination and blood pressure checkup, check the blood pressure, put the cuff around their antecubital fossa area, and use the stethoscope and check the blood pressure nicely. Please check back again. I want to explain some more essential skills you need for this examination. You see, many of you spend thousands of dollars in preparation courses, but I want to tell you, all you need to know are few clinical skills, and you would make through this examination. And I followed this book, USMLE Smasher, and USMLE Smasher, and this is all I followed, and I recommend this book. It's available on Amazon, Barnes & Noble, and get this book, USMLE Smasher, and it takes you a long way. It explains all the basic skills you need for this examination. So get this book, USMLE Smasher. So join me tomorrow for some more videos. Thank you.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.